You know, when you think about robots in medicine, your mind probably jumps straight to those futuristic surgical arms or some kind of sci-fi diagnostic tool, right? But today, we're going to pull back the curtain on a part of healthcare automation that is just as critical, but happens almost completely out of sight. So let me just ask you this. What do you think is one of the most high-stakes, flat-out dangerous jobs inside a hospital? I mean, surgery? Sure. The ER? Absolutely. Those are great guesses, but the answer's probably going to surprise you. It's happening in a place you'd never expect. Turns out the answer is in the hospital pharmacy. Yeah, specifically, we're talking about the manual process of mixing intravenous medications, IVs. This isn't just about counting pills into a bottle. It is a super delicate, high-pressure job where the margin for error is razor thin. And I mean, just look at all the things that can go wrong here. A pharmacist could accidentally grab the wrong drug, or maybe the wrong fluid to mix it with. Even a tiny microscopic breach in sterility could lead to a life-threatening infection for a patient. And get this, when we're talking about really hazardous drugs like chemotherapy, every single dose that's prepared by hand exposes that healthcare worker to toxic stuff. It is literally a daily highway act, but without a net. So this is the exact problem that an Italian company, Health Robotics, set out to solve. They looked at this incredibly risky manual process and just thought, there has to be a better way, a safer way, a robotic way. So who are these guys? Well, Health Robotics is a specialist, a true specialist. They don't do general factory automation or anything like that. Nope. They are laser-focused on one thing, building robotic systems that prepare and compound these really complex IV medications right there inside the hospital pharmacy. And to do this, they developed two amazing flagship robots, and each one has a very specific job. Over on the left, you've got CytoCare. Think of this one as the hazard specialist. It's built from the ground up to handle the most dangerous stuff, like chemo, shielding the hospital staff from any exposure. Then on the right, you have the i.v.STATION, which is the efficiency engine. It's designed to safely and super quickly put together all the other common patient-specific IVs a busy hospital needs every single day. But hey, building a cool robot is one thing, right? Making a real, measurable impact, well, that's the whole ballgame. And when it comes to that, the proof is all in the data. Just look at this number. 0. As in, none. In their beta tests in actual hospitals, these systems had 0 reported labeling errors and 0 drug exchange errors. In a field where one tiny human slip-up can have devastating consequences, hitting a perfect score like this, wow, it's a monumental leap forward for patient safety. And it's not just about safety, it's also about being incredibly efficient. You see, hospitals can end up throwing away up to 40% of pre-made IV bags because a patient's prescription changes or they get discharged. By creating these doses just in time, specifically for each patient, these robots just slash that waste. And when you stop wasting so much money on unused medicine, you get this number. Hospitals using the i.v.STATION saw a return on their investment on average in just 6 months. That's incredible. It just goes to show you that the best solutions for safety can also be the smartest ones for the budget. And to give you a feel for that efficiency, the i.v.STATION can churn out about 35 patient-specific doses an hour. That means a brand new, perfectly measured, totally sterile, and correctly labeled IV bag is ready to go about every minute and 45 seconds. That is a level of speed and consistency that a human being just can't possibly keep up, day in and day out. Okay, so it's really important to kind of zoom out for a second and understand where health robotics fits into the bigger picture. Because the term pharmacy automation isn't just one single thing. It's actually a pretty wide and varied landscape. And this is the key thing to get. The robot that's filling your prescription down at the local pharmacy is playing a totally different game than the one compounding chemotherapy drugs inside a sterile hospital cleanroom. This table just lays it all out, super clear. On the left, you've got your community pharmacy automation. That's all about high-volume pill counting in a retail store. But on the right, that's the world health robotics lives in. We're talking high-risk, sterile liquid compounding inside a hospital. They aren't even competing. They're solving completely different problems. So why does this super specific niche matter so much? Well, because it hits the problem right where the risk is highest. It protects our nurses and our pharmacists, it saves hospitals a ton of money on wasted medicine, and most importantly, it makes patients safer by taking human error completely out of a life-or-death equation. This isn't just automation for the sake of convenience. This is automation for survival. And all of this leaves us with one last big thought to chew on. We've just seen how robotics can bring a level of precision and safety that humans just can't match in this one critical area. So the real question is, where else should we be using this kind of zero-error automation? What other high-stakes jobs out there are just waiting for their robotic solution?